Welcome. We'll now be going to the topic on stress. This topic will be divided into three sections. In the first part, we'll learn about the basics of stress. And I'm Dr. Matangi, Professor and Head, Department of Mind, Body Medicine and Lifestyle Sciences from Sri Ramchandra Institute of Higher Education and Research. At the end of this first part, you'll be able to define what is stress, what are the different types of stress and stressors. Okay, let's begin. What is stress? I think as simple as everybody is undergoing stress. Be it a kindergarten kid or even an employed person or a housewife or an executive, everybody has their level of stress. And stress is defined as the perceived inability to cope. The father of stress is Selye, and he defines stress as a non-specific response of the body to any demand. And he described the changes that happen in our body when we are exposed to such a stressful situation as general adaptation syndrome, or an acronym GAS. Stress is sometimes good because it makes us to excel our own potential, because we are very motivated and we focus when we are doing that particular work. And it is always an excitement to do it and improve ourselves, achieve ourselves. It might be towards some goal or a reward or some relationship or something. And such stress or good stressors, we call it as eustress. That means there is something which is called as bad stress, which is called as distress. It could be as simple as the death of a loved one. We have had some fight, argument, or it is a test, an assessment which is going to decide on something. Okay? Such a thing affects us like anything. These negative stressors or distress is what we are going to see now, because it causes a lot of anxiety and concern. And if it's short term, it's fine. But if it's going to be in long term, it's going to have a detrimental effect on our body, because the unpleasantness for a long term affects our own performance and can affect our mental instability as well. What all could be a stress? It could be right from the ambient environment, how hot it is or how cold it is, how polluted it is, how quiet it is or how noisy it is. Right from our road, which is going to be traffic laden, anything, a room which is very congested, could be a stressor. Any crisis or a catastrophe could be a stressor, like a natural disaster or a war. Or a major event could be a stressor, like a death of a loved one. Or even for a student who's going to, 12th passed out student is going to finish his school. Now he's going to enter the college. That is both pleasant and unpleasant stressor sometimes. For everybody, daily hassle is also a stressor. Like it could be the way traffic, it could be the work in itself, or it could be the interpersonal conflicts that we have at the workplace, could be a stressor. Okay? So we have stressors which are positive personal stressors like marriage or buying a home or having a child. They're all pleasant. But still, it comes in with a small package of stress, which you are very happy to also undergo to a certain limit. Some are negative stressors, as we said. Even somebody who is going in the midst of a divorce, it's a big stressor for them. Okay? The common internally caused stressors or distress is the fear. I could have a fear from anything, fear from speaking, public speaking, or even heights. Anything could be there. Or there could be some repetitive thought patterns that keeps coming to me whenever some job comes in front of me. Or I could be worrying about the future. What next? What will happen if my tests are going to be negative? What will happen if I'm going to fail? Anything could be a stress. Unrealistic, perfectionist, can he himself be a stressor? Nobody needs to be a stressor for him, right? Sometimes it's the OCD makes us into a stress. Sometimes we take more than what we can chew. We don't know how to say a no. We overschedule certain times because of our procrastination. We are never assertive to say a no to some people. We take everything on our platter so that we are loaded with too much of work. So that's our problem lies with us, nobody else, right? So that means whenever we are exposed to something, we are calm initially, we're able to take the stress and we are happy doing it. So that's the phase where even our performance goes up. It's sometimes even appreciated, noticed and appreciated, which we call as the eustress. Beyond that, we're not able to take it up at all. We go into the last stage, which is distress, where I'm not going to be energized, focused or anything. Instead, I'm going to be fatigued, get exhausted and even burnt out. Okay. So we have to see that we are always in this eustress phase. Or if we are in the distress, how do we manage all these things? What will happen to my body if I'm going to be in this phase for a longer period of time, right? And then how do I handle it? In this section, we'll see how the body responds when we are exposed to any stress. Okay? So at the end of this section, we will see what is general adaptation syndrome. And we'll see what is this HPA axis, or the hypothalamo pituitary adrenal axis, and how the body affects every system in our when it is exposed to a stress. Okay. I hope you remember in the last section we saw the father of stress physiology, Selye, who said about GAS. What is GAS? The General Adaptation Syndrome. When we are exposed to a stress, our body immediately responds to it, which is the first stage, which we call as the stage of alarm. Because the body has recognized the presence of a stressor. Body tries to work on it or work towards the imbalance that has been caused by the stressor and maintaining it at a balanced level or homeostasis, which is the stage of resistance. The body is unable to handle it, goes in for the third stage, the stage of exhaustion. Let's see each of these stages, how the body responds when it is exposed to a stress. As soon as I'm exposed to a stressor, the body has identified it. But even before, how did the body respond to it? By the balance being lost or upset in homeostasis. Every cell in the body reacts in a different way when it is exposed to a stressor. Okay? And now, because the body identified that the balance is lost, it works to correct it. That's the stage of resistance. The body tries to fight back and tries to maintain the homeostasis. It's still not able to do it. Most of the time, we will be able to overcome this stage. That's when, most of the time when we are in the eustress stage, it's like that. Sometimes I'm not able to handle it at all. So what happens? I go into the third stage, which is called as the stage of exhaustion, where I'm unable to bring it back to the homeostatic stage. I'm either overwhelmed, I'm prone to more mistakes, or get more injuries during the stage, or I get into other hazardous situation, right? So this is how my body is trying to talk to me that what is happening around me is not suiting me. So that's a stressor, okay? So how did it identify? How did all these changes happen? The minute we have got exposed to a stressor, we have a region in the brain called as the hypothalamus. This region in the brain is the main region for our behavior and our emotions, and it stimulates a system in our body called as the sympathetic nervous system, which releases neurotransmitters called as norepinephrine, or through another gland called as the adrenal medulla for another hormones called as the epinephrine as well as norepinephrine, which are the one which make so many things that we see when we are stressed, like increase in BP, increase in heart rate, all those things happening. In addition, what this hypothalamus does is, it talks to the other endocrine glands of the body. Endocrine glands are the glands which releases hormones in our body. They are like chemical messengers which these glands release for communicating with the other parts of the body. So the hypothalamus communicates with the next gland, again just below the brain, called as the pituitary gland. And This communication is through a hormone called as CRH, corticotrophin releasing hormone. Now, this anterior pituitary gland communicates with a small gland which is above the kidney called as the adrenal cortex, the adrenal gland, through a hormone called as adrenocorticotrophic hormone, or otherwise called as ACTH. What adrenal cortex does is it immediately releases a hormone called as cortisol. This is the hormone which we call as the anti-stressor hormone, which mobilizes energy for us to face the stressful situation. So when we are stressed, the hypothalamus communicates with the pituitary, which communicates with the adrenal cortex to release the cortisol. This axis is what we call as HPA axis, or hypothalamo pituitary adrenal axis. Okay, I'm sure you will be able to connect with this. When we are stressed, the first thing that we see is emotionally we get affected. We either get agitated, frustrated, or we become very moody. We are overwhelmed with what we said in my hand to do now. Okay, it is very, very difficult for us to even sleep or relax or be calm. Sometimes it even lowers our self-esteem and we go in for depression. We would not like to interact or communicate with others as well, isn't it? Now, this has a toll on our psychology as well. We become highly anxious, very tensed up. We are irritable with anything that might happen or anybody who might enter our room at that time, right? Sometimes we get bored doing the job and go in for burnout or an emotional fatigue. We don't have satisfaction doing the job at all. The minute this happens, our job involvement comes down, the commitment comes down, and even the output quality is not good enough now. How does it impact our behavior? We either overeat or we don't eat at all. We are very aggressive. Sometimes we want to make a point to the people whom we are communicating. So the interpersonal relationship goes in for a toss. I already said we can't relax well. That means I have sleep problems too. Automatically what will happen? We go in towards some substance abuse. Could be alcohol, could be a smoke, could be even a drug. Or we become too fidgety with anything that I can put my hands on. Right? I'm sure each one of us have been through some of these things at least. So what happens to it? My memory gets affected. I don't have good concentration ability at all now, right? Very poor ability to concentrate. My judgment is not appropriate. I only see the negative things, not the positive things at all. My thoughts it's a flight of thoughts that happens. We are worried more than being able to focus. We blame others a lot, right? So we have a behavioral change, emotional change, psychological change, and even cognitive changes that happens when we are exposed to stress. It's our body trying to tell us. Are we identifying them? No, most of the time we don't, right? So what happens to it now? Okay, what happens now? If you see here, this is my immediate effect of stress. So that's why we call it as the acute effect of stress. Have you seen that whenever we are stressed, we get severe throat infection or cough or cold? Because our immunity reduces. Okay? We can see that my heart pounding can be heard outside. My heart rate goes up. My BP raises. Have you seen like when we are running against anything, somebody chasing, we are stressed like anything, we get hurt, we start to bleed. The blood has to clot immediately. So that's body's mechanism by making my hemostatic processes hasten. So that means I'm not going to lose blood in that run that I'm going because something is chasing me and it's my death or life situation, right? Bleeding should stop immediately. So my hemostatic mechanism is hastened now, right? I'm going to get exposed to such a stress more frequently. So these things are going to be there for a longer period of time, having a severe clinical consequences. I think that's something which we should be worried about, isn't it? So let's see what it is now. Okay. Have you seen when you're stressed up, you get a slight headache, neck pain, low back pain? That's your muscles telling you, your skeletal system telling you. You're not taking care of it, you can develop migraine and the severe chronic pain, you can see that your posture actually changes like anything, a hunched back, bent posture sort of a thing. Our respiratory rate goes up when we are stressed up. I am an asthmatic. Getting exposed to such a stress very frequently. My asthma drug dose I might require more now because I get wheeze quite often. Have you seen when you're stressed that you don't eat properly? Or you either overeat, you have a constipation or a diarrhea? That's initial phase, but I'm exposing my body very frequently to that. I go in for a severe chronic pain. My eating habit changes. I develop severe acidity as well, having GERD or reflux diseases. Okay. My endocrine system. What are endocrine system? They are the ones which are going to release hormones, right? Which are going to regulate homeostasis in our body. One such hormone which maintains our blood sugar level is insulin. That hormone is not going to be produced regularly, so I can become a diabetic now. We already said whenever we are stressed, the stress hormone, anti-stress hormone, cortisol, its level increases. Have you seen the hormone in your neck region, gland in your neck region, which is your thyroid gland? Now this either overworks to make you work in the stressful situation. Every part of your body is now getting affected. Okay? The minute my thyroid hormone level changes, you can see my body physics changes. My abdominal fat level changes. My sleep gets affected. My thought gets affected. Everything gets affected when each of these endocrine gland gets affected. Okay? Reproductive system, I'm sure you will agree with me, like whenever any newly married couple are highly stressed, it's very difficult for them to conceive because whenever we are stressed, the reproductive system is getting affected because either the male sex hormone, testosterone, or the female sex hormone production is getting affected. There is a loss of libido and fertility. Okay? In male, the male gamete, which is the sperm, its production gets affected. Impotence, erectile dysfunction is seen in the male. In the female, it's being observed in like PCOD, polycystic ovarian disease, or menstrual irregularities, or difficult in consumption. Okay, the heart is one which really has been talking to you right from an acute stress, but I'm not listening to it. Constantly, my heart rate goes up, my BP goes up. I can't now control my BP just being calm. I need more than 2 drugs to control my BP. My blood vessel is going to get blocked with fat plaques. So I develop stroke, heart attack. Okay. So inflammation is much more now so that I can develop a heart attack now. You've seen 45-year-old dying out of heart attack. This is the cause because too much of stress than they can handle. So whenever we are stressed, it is body, mind, emotion, and behavior, all of them showing to you like this is more than what you can handle. Each one is a sign, like a headache or a back pain or even skin infections that we get. Too much of worrying. I'm not communicating with others properly. I'm very accident prone. I scream at others. All these things are signs to tell us that this is something which is more than what you can handle. You're stressed. Man, mind what you're doing. Take care of yourself well. Body is talking to us. This is how our body responds when we are stressed. At this section, what we'll be seeing is the various relaxation techniques, which are very simple that you can do yourself, and simple tips on how you can handle yourself so that you don't get too much of stress. Okay, shall we begin? The first one is simple deep breathing technique. In this technique, what you will do is you will be breathing in slowly. You will hold your breath and then you will breathe out slowly. For example, here I have put it like breathing in, holding breath and breathing out. Each is for a count of 4. Okay. So shall we do it? Breathe in. Hold your breath. Hold. Now slowly exhale. exhale. Breathe in, 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 in. Hold, 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 hold. Slowly but continuously exhale, 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 exhale. Keep doing it at least for 1 minute. This is something you don't need any specific room or anything. Just sit comfortably, close your eyes, and then try doing it. Okay? This is called a simple deep breathing technique. Next is called as a progressive muscle relaxation technique. As the name says, each part of your body you will forcefully contract for a few seconds, count of 10. Again, relax that particular part. Then you go to the next part, like that, from head to toe. Every part of the body is going to be tensed up for a count of 5 or count of 10. And then relax again for a count of 5 or a count of 10. Let's take, tighten your cheeks, your eyes, your jaw, your scalp as much as you can. Let go. Okay, tighten it as much as you can. The minute you say let go, you will see that blood is rushing to that part. But let's take, can you just make a fist in your hand? Tighten your fist. Tighten, tighten as much as you can. More, you can do more. Tighten, 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 tighten. Let go. Did you see the blood rushing into your palms? Like that, you will do for your head, your face, your neck, your shoulders, your arms, your hand, your chest, your abdomen, your hip, your gluteus, your thighs, your knee, your leg, and your soul. Each part you do it step by step. You can go from head to toe or from toe to head, whichever way you want. You can do it in lying posture. You can also doing it sitting on a chair. Okay, just that 1 minute is sufficient to relax your entire body. You feel nice, try to do it. You can even do this before you go to bed. It actually promotes, makes you get sleep very well. Okay, a slight modification of what we do in Shavasana. Okay. Have you seen most of us have too many things on our head? Yes, we have multiple jobs to do. But can you do multiple jobs? We just have 2 hands and a single brain which is working now. Can we do one job at that time? Can I have my entire focus on doing that particular job and not think of the other things? It's like I have so many things to do at home, but now I have my work to do because I'm at my workplace. At this time, should I think of what will I do at home? How will I teach my children? That thought should not be there in my mind. That thought should be there when I go home. When I'm home, how am I going to take my class tomorrow? That thought should not be there when I'm with my children doing the work with them, right? So remember what you should have at your brain now. Okay. Yes, those are your job, but don't ever forget it. But don't have it in your mind now and take your mind off that particular job on which you need your complete focus. So be always mindful. Okay. Best friends for us, our family, our friends, our pet, and the best de-stressor is our pet. And sometimes when things go beyond all these 3 people to control us, it's our faith in God which gives us so much of strength. Yes, this too shall pass. He is there to guide me through. He is there to take me through. That is a big motivating factor for us to undergo any trials or tribulations that we might face. How do we manage our time? Let's focus on what we are doing. As I said, mindful, concentrate, schedule what we have a planner, be it a day planner, year planner, or a month planner, or even a sticky note on our table, sticky note on our computers, so that we don't forget what we need to do. Sometimes certain jobs need not be done by us. We can check before it is being sent. So we need to learn to delegate. Remember, as much as a job is important, our family is very important. Our own personal leisure is equally important. Have time for everything. So that means we need to prioritize. What requires my 100% attention and now, this moment, let me do that first. Okay? Does it have any meaningful thing in my career, my personal life, my job, or for what responsibility for which I have been appointed at this workplace? Prioritize it. Okay? Do not commit to more than what you can handle. That's very, very important. Learn to say a no when you cannot do it. Never procrastinate. Have a perfect planner. Work always before the deadline, not towards your deadline. Complete things, jobs before yourself. Okay? Anything that is against your belief or your inner conflicts, don't take those jobs because they put you into too much of a stress. Okay? Always have a healthy coping strategy. It could be like adding a new skill set for you as well. Please take them. That is very important. Okay? Your lifestyle choices are very, very important when we are how much stress we can actually handle. Can I balance my personal life, my work, my family, and my leisure? Have that. Know what's your purpose of your life and focus most of your energy towards it. We just see that. Take something like I do 20% of that job, I get 80% of happiness, right? The 20% of the job that I don't do, I get 80% of the time that I actually require as well. That 80-20 is very important for us to know what we should do. 20% I do, I get 80% of my happiness. That's the job we need to do. Don't never ever forego on your sleep. It's just 1/3 of your day that you sleep. It is 8 hours, right? But that determines how good is your 2/3 of your time. So focus on the quality and quantity of your sleep. Take good balanced diet. After all, food is the energy for your brain too. Glucose is the energy for your brain too. So do it. As much as your brain is active, physically also we need to be active. So exercise regularly. We say meditation helps in calming our brain. Exercise helps in making physically fit and calm. Avoid any substance abuse, be it alcohol, smoke or anything. Instead, use other relaxation techniques that we have now seen. Okay? Sometimes it is if we change the way we think, it's good. Never have negative thoughts. Be very optimistic. Avoid people who bring in negative thoughts into your head. Please avoid those sneezers. Okay? Like now in COVID, we avoid sneezers. Even negative thought spreaders are sneezers. Avoid them. Disapprove irrational thoughts because they actually exaggerate us. Develop your problem solving skill and as well as your communication skill. Most of it's only these two which gets us into too many problems. Even learning to say a quiet no is a communication style which we need to learn, right? Otherwise, we're going to have too much on our platter than we can handle. Know your boundaries, define it, be honest in your conversation and accept people as they are. I think that's very, very important. I am a perfectionist. I can't expect my subordinate to be as perfect as I am. That's a problem. Learn to accept them. Give them those jobs which could be refined at the next level. Okay? So that's very important for us to avoid stress, especially at workplace. Identify your stressor and eliminate it. Let's have a journal writing. It's not a diary. Okay? It's a journal writing. What caused me stress? Was it the work? Or was it the person? Or was it the time? Or was it that I was doing some other job? Or was it I didn't have the skill set to do it? I could have said a no to it. I could have typed it instead of writing it. There could be so many things. Introspect. Tally your points. See to it that you don't get into the same stress entanglement next time. Handle it better. Always first point fingers at you. Can I change? Because that's all is in our hand, right? Accountability comes to us. When we write and do all these things, we become very accountable to ourselves, right? Let's plan and write things properly so that we are very clear what caused our stress. Was it me? Could I have handled it better? Anything else that I could have done? Let's have an honest conversation with ourselves. Then we can handle the stress better. Cognitive restructuring is a new concept which is like how we think, how we react, Everything is something which we can train ourselves. Okay, this happened. Did I misconceive anything that was said? Did I hear it right? Did I give meaning to the tone rather than the words actually intended to? Okay, let us do a conscious cognitive restructuring so that most of the time we distort it. Okay, this is something which we can do it in our journal writing. When we are clear on what we got wrong, let's rephrase or restate our thought so that we don't distort it. Okay, so that is most of the time our problem. Why did this person shout at me like this? Forget the tone, think the words. Sometimes that gives us more meaning rather than the tone. I do agree, tone creates the stress more, but sometimes let's restructure it in a different manner. So simple ways to de-stress are deep breathing, the progressive relaxation technique in the yoga. Let's meditate. That guided imagery is another thing which helps us in reducing our stress. Let's take the best holiday that we have had with our family. Close our eyes. Let's spend that 5 minutes in the beach where we spent with our family. I think that beautiful moment that we had with our family will de-stress us. Let's come back to our work. Let's listen to a pleasant music. Do some physical exercise. Just get up, walk around, and then come back. You will feel fresh. First, you've got enough exercise. You've moved out of what you were doing, bogging you. You got enough oxygen as well. Some nice thoughts also comes to us when we are in a new environment. Okay, let's draw something. Simple things, simple sketching, some art. Okay, anything could help us in stress buster. You remember the column that people used to put in the South Indian homes on their front of the home? That is a very good stress buster. The Zentangles, the mandala art, all these things are good stress busters. Let's have an emotional forgiveness practice. And the positive sharing, WhatsApp forward. Let it be more of positive sharings rather than negative sharings. Can we have some nice aromatherapy? Good hot oil massage, nice hot water bath, some hot coffee, tea, with my pet sitting in the garden. Nothing else, just blank scenery which I'm going to watch out. Simple things helps us de-stress. Watching nice music album or a movie, reading a wonderful novel with a pleasant breeze across us, painting something that we can. Everything is a good stress buster. Let's try to relax ourselves as much as we can. Stress is something which is telling our body like this is something you can't handle. It's changing so many things in our body, right from raising heart rate to respiratory rate to BP to anything which can be detrimental in a long run. So let's learn to manage us better, manage what's there in our hand to do better, manage our interpersonal relationships also, have a mild cognitive restructuring and learn to relax ourselves. I hope in this section you learn something about stress and how you can handle yourself. And this was Dr. Matangi to you talking about stress and how you can handle yourself. Thank you.